Okay. Today we're going to talk about the positive response and use of drug therapy. Show of hands, who would provide drugs to a patient with symptoms of psychological disorders? If you were to prescribe the patient because they're coming in and they're stating that they're having different kind of problems and you actually diagnose them in the correct way, would you provide medications to this patient?
Yes.
Show of hands. Okay. Today we're going to talk about drug therapy, therapeutic drugs, and why do we prescribe these drugs to patients. Therapeutic drugs, there's 3 different types. There's anti-anxiety drugs, antipsychotic drugs, and mood stabilizers. First, we're going to talk about the use of anti-anxiety drugs. Basically, they're used to relieve tension, relieve apprehension, relieve nervousness, and examples of these drugs are Valium and Xanax. And it states that nearly 100 million prescriptions of Valium or some similar anti-anxiety drug is filled in the U.S. each year, and that's according to Lockheed and Gordon. And we actually say that that's a lot of medication that's filled because it's so easy to get, because different patients can come in and say that they're experiencing these symptoms. And we're going to talk about the use of antipsychotic drugs, which reduces psychotic symptoms. It reduces hyperactivity, it reduces mental confusion, and it also reduces hallucinations and delusions. The examples of these medications that's generally prescribed to these patients are Thorazine, Marilil, and Haldol. And these actually reduces the relapse into active schizophrenia episode. So there is a likeliness that they can actually go back into these schizophrenic episodes, and that's according to Martyr and Van Kemmen. So it's not definite that we can actually take these symptoms and reduce them. Then there's the use of mood stabilizers. They're used to control mood swings in patients with bipolar disorders. And an example of this medication is lithium. Now, lithium is actually a dangerous medication, and it produces dangerous side effects. And that's according to Jefferson and Geist. They actually produce thyroid gland complications. It produces kidney problems, and it can even be toxic and or fatal. And the effects of drug therapy, there's different side effects. Some of the common side effects are drowsiness, nausea, and you can actually experience diarrhea. Some of the health effects are, it may be problems with your kidneys. It may be problems with your thyroid glands. So you just have to be careful. And some of the life-threatening effects equals the fatalities, which is the death. Now, there is patient abuse, whereas some patients, they feel like they're dependent on it. They feel like they can't get off of these drugs, and they have to actually experience and go through these different drugs. There's the superficial effects, whereas a patient feels as though without these drugs, they wouldn't even calm down. They would still be experiencing some of the same symptoms that they experienced before they actually had these drugs. Then the temporary effects is that it keeps them on the medication. It'll lure them on there until they can't even wean off of it or try to find different solutions without actually taking the medication. Now we're going to talk about prescriptions in patients. There's different alternate prescriptions, that's what we're trying to get through. We're trying to get different medications that can reduce these side effects. It can actually bring us into a more positive feeling without all of the negativity that the different drugs that we're actually talking about before, whereas those drugs are too strong. So some of the milder are Busbar, which appears useful in anxiety disorder. And that's according to Brahman, Mitzer, and Leonard and Ballinger. So that would actually work and reduce some of the symptoms that, different medications would cause, as far as the Xanax. There's atypical antipsychotic drugs, which that reduces and it provides fewer unpleasant side effects. And that's according to Carell and Luke and Kane. Then there's valproate, which is effective as lithium. It produces future affective disturbances. So whereas lithium may be fatal, valproate may actually decrease those symptoms, and you wouldn't have to worry about all the different fatalities that lithium can provide. Now, patient care. In order to go through with these different medications, it's imperative that we actually provide and go through these patients and go into detail and in depth, so that way we can make the right diagnosis. So one of the things we want to do is we want to look at the patient history. We want to look at the patients and see as far as what has been their diagnosis, what kind of medications they were on, what was the dosage of the medications that they were on, so that way we can reduce that. Then we want to go over actually diagnosing the patient. So making sure that the diagnosis that we said regarding the patient was actually the correct diagnosis. So if it is schizophrenia, that we're going to diagnose them with schizophrenia, and or if it's antidepressants, that we're going to diagnose them with antidepressants. So we want to make sure that we actually are diagnosing these patients correctly. Then we also want to monitor the patient. So once we go through and we want to give them these different medications like the Buspar, and so that way they can go through, and we want to monitor that patient. We just want to make sure that what they're doing is correct and that they're taking the correct dosages. And in conclusion, we want to look at that, even though we are human, and that's our job, to actually diagnose these patients, we want to make sure that we're actually diagnosing them correctly, and we're not overdosing causing the patients to overdose, or causing any fatalities, or causing any kind of deaths, or just someone being hooked to a medication because they're on it and we're prescribing it for them because they're coming in and they're stating that, hey, we have these diagnoses, and I feel like this is my symptoms. So we want to make sure that everything is correct and that we're doing the best things possible for our patients, and not just doing it because it is our job, because everyone is human and we all need our lives. And that concludes the presentation.